Hi guys, welcome again. Today we're going to tackle the title or the topic of constipation. I know we have all experienced constipation in one way or the other in this lifetime. So today let's talk about what constipation is, what causes it, what can we do to help prevent this. So welcome, and I hope you learn one or two things. So, what's constipation? Constipation is passage of hard stools. Usually, it happens if somebody has not had a bowel movement for more than 3 days or more than 3 days in a week. So this causes stools to be hard to pass or just straining with stooling. And chronic constipation happens if somebody has had this trouble passing stools for more than 3 months. It could be, less than 3 stools per day for happening frequently for more than 3 months. That's called chronic constipation. So that's what constipation is, passage of hard stools. So what causes constipation? We will talk about a few things that can cause constipation. We'll talk about diet, we'll talk about exercise, and then medication. But there's other causes, but these are the main ones that we'll focus on. So eating sugary, processed, and low fiber foods can lead to constipation, and also not drinking enough water. So water really causes increased in motility of our foods that we eat through the gut, and as well as the fiber. So those are the things that facilitate that movement, and a decrease in this can lead to constipation. Lack of physical activity and sedentary life slows down motility in your gut as well, leading to constipation. Some medications can cause constipation. Most of this listed here, pain medication, muscle relaxers, antidepressants, those causes decreased in muscle function or decreased in the relaxation and contraction of your muscles in your gut, that way decreasing movement, or what's called peristalsis. Iron and calcium supplements, those can cause constipation as well. Antacids, diuretics, cause reabsorption of water, and therefore causes dry, decreased water in the intestines. Chemotherapy can cause constipation as well, because chemotherapy targets the lining of your gut as well, because it has cells that rapidly divide, which is the target for chemotherapy. Some conditions that can cause constipation as well is like blockages or tumors in your colon. Usually if you have a tumor growing in your colon, it can lead to blockage in your colon and cause constipation or lack of passage of stool through your intestines. Also some problems with pelvic floor muscles, which leads to decreased contraction or motility in your gut, can lead to constipation. So let's talk about water recommendations. Did you know water makes about 50 to 65% of your body weight? So as we talk about water, just know that your body needs water to function. Water is needed for every cell in your body, all the function. It's like your car, your car needs gas, your car needs oil. So it's the same way with your body. You need water to function. Dehydration can, signs of dehydration could be a headache, dark urine, dry mucous membranes, or dry mouth, dry skin. In extreme conditions, we see patients with dizziness, confusion, or changes in their kidney function. The recommended water intake per day is is about 50% of your total body weight. Let's say you're 180 pounds. So the recommended water intake would be 180 divided by 2, which is 90 ounces. That's about 11 cups of water. That's a lot. That's a lot of water, but at least try to drink about eight cups of water per day. But that would be the recommendation. As far as those conversions, if you're wondering what is, how do I convert from pounds to kilos, it would, to get into kilos, you take the amount of weight in pounds, let's say 180, and divide by 2.2, then you get your kilos, or vice versa. Your kilos to pounds would be the the weight in kilos times 2.2, and that gives you the amount in pounds. And then 1 ounce is 30 milliliters, and 1 cup is 8 ounces. So those are just conversions that I wanted to bring into your attention. But that's the daily recommended water intake per day. Let's now talk about fiber recommendations. This I got from this website, like a government website that talks about fiber recommendations. There was a summit back in 2014 that really mentioned that Americans particularly, we are very low in fiber intake. 1 in 10 Americans receive or take the recommended fiber intake, and this was really surprising to me because that's low. And the reason being we eat a lot of processed food, so I think we need to be cognizant of that and try to increase fiber in our diets as you shop, as you go grocery shopping, or buying even cereal for our kids, or buying any foods. Just try to read the food label. Try to read the food label, because that really will tell you what you need, or the best foods to buy that contains enough fiber. As you see on this chart, how much fiber should you take? The chart goes from children to adults, and it breaks it down to even males or females. So those are the recommended daily fiber intake. So just take a look at that, and I will share my slides down in the comment section, so you can just review that and just see if you can meet those daily requirements of fiber. So like I said before, pay attention to food choices, pay attention to food labels. The best source of fiber food would be anything that has 5 grams of fiber per serving. As I was going through some of the foods that I have in my pantry, and realized that, oh my goodness, some of them do not even have the 2.5 grams that are recommended for a good source of fiber. So I looked at some of the nutritional bars that we have. They have like 2 grams of fiber per serving. I looked at the ramen noodles that my girls like to eat, and it has less than 1 gram of fiber per serving. So just try to find foods to combine with those things that our kids like. As far as cereal, I know my kids, they don't like whole grain cereal, but I think it's an acquired taste, so I think maybe we just need to work on that and try to buy cereals that are high in fiber to help to help improve our daily fiber intake. What are some of the foods that are high in fiber? This is just a list of the some of the vegetables, fruits, and legumes that I found. But green peas, that jicama, those were the ones with the highest fiber. I've never tried that jicama, but I think I'm gonna try to find it. Sweet potatoes, winter squash, broccoli, carrots, potatoes, corn, Brussels sprouts, collard greens, so kale, artichoke, asparagus, and others. As far as fruits, the berries are leading, like blackberries, raspberries. Those are really high in fiber. pears, oranges, avocados, strawberries, apples, and all that. The one that really surprised me a lot is like, watermelons and cantaloupes. Those are the ones that I like, but they have less fiber. So down below, I'll share a link. It was an article from the VA health system that really lists all the foods, most of the foods, and their fiber content. So I found that really helpful while I was doing this. As far as the grains, barley has the highest fiber content. I know we like white ugali, but maybe we'll try to use barley to make ugali. We'll see. Lentils, I love lentils. Beans, peas, Hershey cereal, fiber 1 bars, bran flakes, all those are good sources of fiber. What are some of the complications that can happen from constipation? Hemorrhoids can form. I don't know, I've seen really huge hemorrhoids that require surgical correction, and the problem with hemorrhoids is if they get irritated, they tend to bleed, they cause a lot of pain. So if you have hemorrhoids, just try to work on constipation, and that will help decrease the swelling in those veins. Torn tissue in the anus, so tears or fissures can happen due to straining. And if you're having issues already that you're dealing with as far as bleeding concerns, let's say for example people that are going through treatment, chemotherapy and such, and they have low platelets or low counts, the tendency to bleed is high. And also risks of infection. If you're already immunocompromised, there's a high chance that you may get infection if you have those tears or fissures in your anus. Fecal impaction or blockage can happen. I've seen extreme small or large bowel obstructions that require surgical intervention. So to help prevent this fecal impaction, let's work on our diet, work on constipation. Bleeding can happen, as I mentioned earlier, because of straining, and then rectal prolapse can happen because, again, of repeated straining. So in conclusion, I just wanted to bring into your attention the importance of water intake, importance of high fiber in your diet. Drink adequate water. I mean, you don't have to get the exact amount, like 11 cups or 10 cups. Just try to get at least 8. How do we do this? Just when you wake up, first thing while you brush teeth, take a cup of water. And it's recommended to do warm water. I know some people get grossed out when you mention warm water. I like drinking warm water in general, so try to do that, warm water first thing in the morning, and then you can take a glass with your breakfast, take a glass between lunch, take a glass before lunch, after lunch. Just try to drink 1 glass whenever you think of something to drink. If you can try to avoid sodas and just drink water, even juices, substitute that with water. That will help you because your body needs water. Increase fiber intake. Like I said, try your best on food choices, and that will help you increase your fiber intake. Exercise, helps just with motility in your gut, so try to exercise. Create a stooling routine, especially with the elderly, because those are the ones with the high risk for constipation. So try a routine every time. Go in the morning, the first thing, that's usually the best. And also people that have anxiety as far as stooling in public or using the toilets in public. So starting a routine where you use the bathroom before you leave your house, that's the best. That way it avoids the need to hold your stool until you come home. So those are some of the things that I wanted to bring into your attention, to do some education in something simple that we can all control. And I hope you learned something. And thank you so much for watching. And the next slide is resources. Like I said, I'll upload this in the comment section so that you can click in this resources section. And then this last page talks about it's the references where I got all this research-based information. So thank you so much, and I hope you learned something. If you like this content, please subscribe so you don't miss more content like this. Thank you.